Today we will be talking about autism. Did you know that boys are 5 times more likely to be diagnosed with autism compared to girls?
Whoa, that's crazy. How many kids are affected by autism?
Well, autism affects 1 in every 68 children.
What is autism and what are the signs?
Autism refers to a broad range of conditions characterized by challenges with social skills, disruptive behaviors, speech, and nonverbal communication.
Whoa, that's a lot more than I thought.
Yeah.
How was the term autism originally used?
The term autism was first used in 1911 to refer to one group of symptoms related to schizophrenia.
What? What happened to the autistic kids and adults in the 1930s?
In the 1930s, before they had a full understanding of what autism really was, they put them in an insane asylum.
Whoa, crazy. When did the researchers start to really understand what autism is?
In the 1940s, researchers in the United States began to use autism to describe children with social and emotional problems. Leo Kanner, a doctor from Johns Hopkins University, used it to describe the withdrawn behavior of several children he studied. At about the same time, Hans Asperger, a scientist in Germany, identified a similar condition that's now called Asperger's syndrome.
Whoa. Until what time did scientists think that autism and schizophrenia were the same thing? And what is the actual difference?
Until the 1960s, autism and schizophrenia were thought to be the same until scientists and medical professionals had a better understanding of the two. The difference between autism and schizophrenia is that schizophrenics experience strong hallucinations while autistic people don't.
What are some treatments for autism?
Treatments for autism focus on things such as LSD, electric shock, and behavioral change techniques. These treatments were mostly relied on for pain and punishment. From the 1980s to present, the use of behavioral therapy and controlled learning environments have been the primary treatments for many forms of autism.
Currently, there are different kinds of therapies to improve speech, behavior, and sometimes medications to help manage the conditions related to autism.
What is applied behavioral analysis?
Applied behavioral analysis, as known as ABA, is often used in schools and clinics to help your child learn positive behaviors and reduce negative ones. This approach can be used to improve a wide range of skills, and there are different types for different situations.
Interesting. What type of training is there?
Well, there's a couple trainings. There's this one called Discrete Trial Training, known as DTT, that uses simple lessons and positive reinforcements. There's also another one called Pivotal Response Training, as known as PRT, helps develop motivation to learn and to communicate with others. And there's another one called Verbal Behavioral Intervention, known as VBI, and this focuses on language skills.
Very interesting. What is the main goal of these 3 behavioral interventions?
This kind of treatment is better known as floor time. That's because it involves you getting on the floor with your child to play and do the activities he or she likes. It's meant to support emotional and intellectual growth by helping him or her learn skills around communication and emotions.
Interesting. Are there any other treatments that help?
Yes, there's another treatment called the Treatment and Educational of Autistic and Related Communication Handicapped Children, known as TACCH. This treatment is visual cues such as picture cards to help your child learn everyday skills like getting dressed. Information is broken down into small steps so he or she can learn it more easily.
What are some therapies that can help with autism?
Some therapies that can help with autism, one of them is called occupational therapy. It's a kind of treatment that helps your child learn life skills like feeding and dressing him or herself, bathing, understanding how to relate to other people. The skills he learns are meant to help him live as independently as he can. Sensory integration therapy can be used if your child is easily upset by things like bright lights, certain sounds, or feeling of being touched. This therapy can help him or her to learn to deal with that kind of sensory information. Risperidone is the only drug approved by the FDA for children with autism spectrum disorder.
What is the use of this drug and what ages does it help?
This drug can be prescribed for children between 5 years and 16 years old to help with the irritability.
Are there any cures or medications that can help with autism?
There is no cure for autism spectrum disorder, and there's no currently medications to treat it. But some medications that can help with related symptoms like depression, seizures, insomnia, and trouble focusing. Studies have shown that medication is most effective when it's combined with behavioral therapies.
What other drugs have doctors used?
Some doctors will prescribe other drugs in certain cases, including selective serotonin, reuptake inhibitors, anti-anxiety medications, or stimulants, but they are not FDA approved for autism spectrum disorder. Thanks for watching our crappy video.